I'm on the. Oh, right, it's being recorded. But don't worry, it's on speaker view, so it's only going to be recording the presentation so that anybody who couldn't make it today is able to um, still get the information. So that's that. Bisham, would you like to introduce yourself?
Sure, yeah. Hi, everyone. My name is Basham, and I am the Manager of Community Development here at the New Canadian Center. Thank you all again, as Jocelyn said, for being flexible and switching times and for joining us here for this info session and at the health fair in a couple of weeks. And I'll pass it to Allison.
Hi, everyone. My name is Allison Mitchell, and I work at Peterborough Regional Health Center. I work in the outpatient family and youth clinic as well as the outpatient eating disorder program. And yeah, thank you for being here.
Hey, I always like to start with a land acknowledgement for presentations. I think if you're invited to this health fair, then that's because you're in the Peterborough region. So obviously we are located on the same territory, which is the traditional treaty territory of the Mississauga, Anishinaabe, and Chippewa nations. Here in Negotiawanong, that is land that we know is covered by both Treaty 20 and the Williams Treaties. I think for me, it's particularly important given my work to always um, recognize the privilege that I have to do this job. If you're not familiar with KSAC, the Sexual Assault Center, my whole job is going around and talking to people about consent and healthy relationships. And that feels really weird because the only reason I'm here with this job is because my ancestors didn't really give a hoot about consent when they came over here and taking whatever they needed. I think especially too when we're talking about, Canada and how wonderful it is that we are able to welcome so many newcomers, that we're also keeping in mind, the people who were here originally as well. So thank you, everybody. Cool. So today's agenda. So Allison is going to go over a little bit of logistics about the event. So who else is going to be participating, overview of the event schedule, what you can expect, everything, parking, all of that good stuff that you need to know. And then Nisham is going to lead us through a little bit of New Canadian Center client profile. So we get a rough idea kind of about um, who will probably be attending this event, and then as well tips for how you can speak with an English language learner or with an interpreter in person. And then at the end, I will go over some commonly used translation apps and grammar tools and give a couple quick demonstrations on how you can use those to prepare any materials you have ahead of time. Wonderful. Allison, it is all you now.
All right. Well, I'm not going to try to read every organization off, but take a good look. There's so many organizations coming this year. We're so pleased. It's a really nice range of some of our bigger systems are showing up as well as some of our smaller organizations. I hope everybody here sees their logo on there. Yeah, so just sit with it for a minute, take a good look. Lots of representation. Does everybody see their logo on there? Yeah?
Yep.
Good.
Hello.
Hi.
Hi, I'm Crystal
Hi,
from
Crystal.
hi, I'm from the Canadian Council of the Blind, and I am totally blind, so I don't see anything on
Okay, well,
there.
I can confirm,
Is there,
Crystal,
Crystal?
it's on
Okay.
there.
All right, thank you.
Thanks for asking. Okay, next slide. There we go. Okay, so our health fair is going to run from 11 a.m. until 2 p.m. on Wednesday, April 23rd. The New Canadian Center is housed in um, St. James, which is right at the corner of, is it, Basham, help me,
It's right at the corner of Aylmer and Romaine in the St.
Elmer
James
and
United
Romaine,
Church.
right. So you are welcome to come, or whomever is coming from your organization is welcome to come at 10 a.m. that morning to start setting up. And I know when each organization completed the registration, we were asking you all to bring your own tables. That has changed. NCC now has enough tables for everyone. So this is a new piece of information. Please share with your colleagues. You do not need to bring a table anymore. So at 10 a.m. that day, there's a very small parking lot at NCC. So if you have mobility concerns, please park there. If you do not have mobility concerns, we ask that you maybe find parking at the YMCA, which is just around the corner at Elmer Street, 123 Elmer Street South, or the Sacred Heart Catholic Church, which is also sort of just around the corner. Both of those are good options for parking. So you can come in at 10 a.m. with, whatever you have with you. Um, and there will be a table with your organization on it. So we've already kind of mapped it out. So you just kind of have to saunter in and find your table. And of course, if you need help unloading your car, you can kind of pull up and there will be lots of people sort of bustling around helping. Is that clear? Kind of parking? Yeah. Okay. Next. Okay, so if you've attended any sort of promotional fair or engagement, you realize that having swag or pamphlets, being approachable, kind of out from your table, wanting to talk to people, wanting to interact and engage, that helps people to feel a part of the process, right? And so we encourage you to bring all that you are able to bring. If you have it only in English, that's okay because attendees will be able to translate later on. So please don't not bring things because they're only in English. That's okay. Um, Anything that engages with the folks as they're walking through is great. Games, activities, giveaways, all sorts of things like that really help to, yeah, promote communication and interaction and really kind of improve the whole vibe, right? Yeah, that's it for me. That's next one. Okay, and so this is important. There's going to be multi-language ambassadors sort of buzzing around the gym throughout the fair. And so these are volunteers from NCC that are just showing up because they want to help the fair be meaningful. And so our understanding is that the ambassadors will have a sticker on their shirt which says which languages they can translate or interpret for. So if you find yourself face to face with a newcomer, there may be an ambassador that can support a conversation. And so, you just have to sort of wave or request somebody to come over, or if they don't speak the language you're looking for, they may be able to find somebody who does. And then it's really important to remember that if you are using one of the ambassadors to speak to the attendee, not the translator, right? That's something that it's so easy to do. And yeah, we encourage everybody who shows up to move around the room and interact with the other service providers that are there because it's a really good opportunity to network and to come together and to just share that space. And yeah, we hope that everybody gets a chance to kind of leave their table and buzz around and perhaps take in one of the breaks, the wellness breaks that we have structured. Yeah. So
Thank you
there's
so
the
much,
schedule.
Allison.
Yeah, you're welcome.
So I can go through a little bit about the schedule. So in addition to the fair, so the fair is open, as Allison said, from 11 a.m. to 2 p.m. And you'll be stationed in our large gym here at the New Canadian Center, where folks can just come in and they can walk around and chat with your organizations. We will have two structured breaks where we'll be facilitating some wellness activities. So the first one is at 11:15 a.m. and it will be a chair yoga practice in the small auditorium, which is just across the hall from the gym. So it's a quieter space where folks can go in, they can learn a little bit about yoga and be um, be guided through a practice in yoga, facilitated by Christina Domsick of Knitted Heart. And then at 12 to 12:30, there'll be a second wellness break where Alyssa McFlynn will facilitate a mindful meditation. So the purpose of these two activities is really to demonstrate to our clients, newcomers, some simple activities that they can use within their daily life to help with managing stress and for their wellness. And with these activities, we encourage, similar to last year, all of you, if you need some time away, to just feel free to join in these activities. So they're not just for the attendees, but they're also very welcome to you as partner agencies to join in those breaks as well. At 1 p.m., there will be a presentation by the Canadian Mental Health Association on stress management. And so it will be in a small auditorium as well, just across from the gym. And they'll be going through some information on what stress is, what it looks like, and some ways that we can implement activities in our daily life to manage that stress. This presentation will be simultaneously translated into 3 different languages. So there will be live interpretation in Arabic, in Farsi Dari, and in Somali, in this room as well. And so similarly to the breaks, you're welcome to join in for that presentation as well. The schedule will be posted throughout the room, and it will be helpful if you can help share this information with attendees coming to the health fair as you're engaging with them at your tables, just checking with them if they know what the schedule is, they know where the room is and what the activities are, and as you're engaging with them on your services, if you can help direct them to these activities as well, that would be super helpful. So as we move on in our agenda for today, we wanted to share a little bit about who you can expect at the fair. We facilitated this fair for the first time last year, and there were about 150 newcomers who attended the event. This is a snapshot of our client base at the New Canadian Centre. So in the last year, we served just over 2,000 newcomers in the Peterborough and Northumberland regions. And those individuals came from over 100 different countries, spoke more than 70 different languages. Our top languages for the past year were Arabic, Ukrainian, Somali, and Farsi Dari. So if you're looking to translate any of your materials for the fair or for your organizations, these are the 4 top languages for the past year. So these are probably the languages that you'll see most of the newcomers that you're engaging with as speaking in their first language. Another interesting stat to share is about the age breakdown of our clients. So in the past year, 16% of our clients were youth under the age of 14, 22% were in the age ranges 15 to 24, 41%, which is the highest number for us, are in the ages of 25 to 44, 16%, 45 to 64, and 4% are over the age of 65. For the most part of this event, you will mostly be engaging with folks that are in the age range of 25 to 64. But for the most part, many of them are from family systems. So they may have questions related to opportunities for their children or for their parents as well. As we move along on our agenda, every 2 years, the Peterborough Immigration Partnership facilitates needs assessment of immigrants and newcomers in the Peterborough region. So our most recent needs assessment was conducted in January and February of this year. And I wanted to just spotlight 2 of the pieces of information that has come out of that report. So they were over 300 individuals in Peterborough who completed this survey to share more about their experiences here in Peterborough. And they were asked to share a little bit about the top challenges they faced in the last 12 months. And so, not surprising, This is reflective of the wider community as well, but those challenges included finding work and or losing employment, finding affordable housing, making friends and social connections, access to healthcare. So it's very similar to the wider community as well. And one of the reasons why we see a great value in sharing information with this health fair. Uh, uh, Survey participants were also asked to share a little bit about reasons why they're not accessing community services, or if they access community services, what barriers do they notice? And so some of the prominent answers that they shared were not being aware of what the services were, or not having enough information about them, long wait times, and cultural or language barriers that hampered their ability to meaningfully engage or learn about those services. And so these two stats are really, we share them today because they're really reflective of the why that we're doing this health fair, is to provide a space where newcomers can learn about the services that are out there in our community in a very safe and meaningful space. And so there's a lot of value that our clients see in, in coming to this event. And we really are grateful to you community partners for being willing to come and engage with our clients at this event. If you're interested in learning more about the needs assessments and some of the findings, it will be uploaded to our website sometime in the next week or two, and the website is included here on the screen, where you can see the full report and findings from that assessment as well. So as we move along, we wanted to share a little bit of information on tips when working or speaking with an English language learner. So some of the tips that it's a question that we usually get quite a lot, uh, um, is how do we meaningfully engage when someone has very low English comprehension? And so some of the things that we want to keep in mind are when you're learning a new language, your comprehension is usually at a grade 4 level for the first little bit. And so it's usually much more helpful to speak in very simple language and using very short sentences and avoiding jargon and idioms. I'm a newcomer to Canada, and one of the things that I learned a lot is that Canadians use a lot of idioms, and that doesn't always translate very well across cultures or across languages. And so a lot of times when you're learning a new language, you take the idiom very literally. And so when working with an English language learner, we want to try to minimize those opportunities for those very literal translations. So just speaking very simply and very clearly is helpful. Speaking slowly is also helpful because it allows the learner, some time to really take that in or ask questions. Speaking slowly doesn't necessarily mean just starting right away and jumping in, because it can kind of get into that assumption that someone doesn't understand. So I usually suggest going in just speaking at a normal level and kind of gauging for yourself where that language learner is, and how you need to adjust. If you need to go a bit slower, or you can keep a pace that is more familiar for you. It is usually very helpful to use nonverbal communication. So using your hands a lot can be very helpful to demonstrate this to people. So if you're expressing an action, using your body and using your body language to demonstrate what you're trying to convey can be helpful, as well as using visual aids. So pulling out your phone and showing them a picture on Google can be helpful to demonstrate what you mean by yoga, or what you mean by going for a walk or running, or the location of your service. For instance, as you're having a conversation with the speaker, another tip that is helpful is to repeat back what they say to you and to ask for confirmation that, so instead of asking, do you understand, to instead paraphrase what you understand and ask them, did I get that correctly? Or is there something that I'm not getting correctly? And as Allison mentioned, and Jocelyn mentioned, Jocelyn's going to go over some websites and apps that you can use on your phones for on-the-spot interpretation and translation. But you highly recommend having your phone with you or an iPad with you with those apps or those websites readily available. So if you need to, you can just pull it out and we'll show you a little bit later a demonstration of how to use some of those apps with you. As Allison mentioned, we will have multilingual ambassadors around the room who are available for the purposes of helping to guide the clients and helping with interpretation if you need it then. So they'll be wearing red NCC vests and they'll have a sticker on them to indicate what language they speak and can translate for. So you can always flag them down and ask them to help you translate for a client that you're working with. Some tips when you're working with interpreters or these multilingual ambassadors that can help is to remember that they're there for the purposes of helping you facilitate comprehension. And ideally, the interpreters, their work is to translate verbatim. So they will translate directly what you say instead of changing it up, and they will translate without any personal judgments or their own input into the conversation. It's always good to acknowledge the interpreter and to check in with them that they're understanding clearly what you're saying. But as you're having that conversation, to speak very directly to the client themselves. And I know that sometimes can go against like what we learn as active listeners, to look very directly at the person that you're speaking with and demonstrate that you're listening. But in this case, we have to shift our attention a little bit to look directly at the person that we are communicating with and let the interpreter be that in between there. Some of the ways that we can facilitate that meaningful connection is to look directly at the client and to remember to speak as if you were speaking directly to them. So one of the things that usually happens is that we will ask interpreters to say, can you ask them what they need help with? Or can you ask them if they understand? Or instead, to just speak directly to the client and say, how can I help you? Does this make sense? Or do you have any questions? The interpreter in turn will translate that very directly for the clients. Similarly to engaging with English language learners when working with an interpreter, short sentences is usually very helpful for translating. So using short sentences in simple language is helpful. And if you're working with an interpreter, to go at a slower pace. So that will allow them enough time to capture what you're saying and translate it back. So just leaving enough room that they can translate that meaningfully and accurately, and giving them space if they need to ask for clarification on any of those items as well. And so with that, I will pass it on to Jocelyn to go over some of those tools that we find useful when relying on the spot translations.
Perfect. Thank you. Okay, so I'm gonna kind of briefly go over a couple of different programs that you can use to help prepare some, handouts and things to have, and then as well some of the on-the-spot translation services you can use, as Bisham said, if you have an iPad or a computer with you or your phone. So I'll go over 3 of them that are pretty user-friendly, and then I will do a couple little demonstrations. So the first that is a commonly used one is called Hemingway Editor. So this isn't a translation service, but this is like a grammar service. You can get it like downloaded as a desktop app, but you can also just type in like Hemingway app and then open their website and you can still use it. Basically, all you have to do is put in any text, anything that you're writing, and then it will give you edits in terms of readability. So it gives you a grade level. So like what grade level would comprehend those words. It lets you know if you have jargon. It lets you know if you have sentences that maybe are too long. So that's really good if you're looking at maybe making a specific handout for this event and you want to make sure that you're making it at a level that folks whose English is not their first language would be able to understand. So if you kind of aim around like grade 8, 9 readability level, that can kind of help. I know, especially a lot of our organizations, we get so used to the jargon that we say every day, and we expect that everybody will understand that. So, this is really helpful for that. And again, I'll show you a demonstration of how I used it for a poster that I made. There is a pro version that you can do a subscription for, and you can get 2 weeks free. It gives you a couple other options, like being able to upload an already written document. AI can kind of help you rewrite. It's probably not necessary to do that unless you think you're going to use this a ton. But again, if you're okay with just typing in there or copying and pasting words, it's just really helpful to make sure that everything that you're writing is as base level understanding as possible. Awesome. Okay, cool. So first of two on the spot translation tools, DeepL. This again is something that you can pull up on the website or download as an app. If you've ever used Google Translate before, it's basically set up the exact same way where there's a box where you can type or speak into, and then you can pick which language to translate to on the other side. So if you've used Google Translate before, you will understand how to use DeepL immediately. A couple differences between them. So DeepL is better at doing more nuanced translations. I'm sure we've all had those instances. I remember back in like high school French class where you would, type something in English to get it in French, and then, the grammar was not all there, or it was translating it word for word, which there's only going to be so much that we can do if we're not native speakers of that language. DeepL is a little bit better at getting those grammar nuances correct, but they do have less options for countries. So I think they have about 30 some countries, mostly European countries. So it's going to do a better job at translating those specific languages, but it doesn't have as many options as Google Translate does. Again, there is classic, you can pay for a subscription to get more things such as uploading files, PDF, Word documents, and things like that. But at its base level, you can use it just like Google Translate in the moment. Sweet. And Google Translate. Again, I feel like most of us have probably used it at some point in our life, even if it was just for your own homework assignments like I did. But I'll show it briefly later. Again, tends to be a little bit less accurate for commonly used language, so it's not maybe going to get as much nuance. So again, important that we're using those short sentences, trying to cut out jargon still, even when it's something that we're typing out and saying into the app. But they have over 100 languages, so there's a lot more options and a lot more options for places outside of Europe, which, as we see from the survey, is, the majority of people are speaking languages that are spoken all around the world. Google Translate, you can also, for free, upload documents and images as well. So that can be really helpful, that you don't have to pay for that extra service. So again, if it's something that you already have like a flyer of your services and you want to translate it into those, 4 most used languages, you can upload it as a photo there, pick a language to translate to, and it'll do that for you. So that's so fun. Okay, great. I am going to replace the current share. So sorry, Sean. And share my screen. Great. Can folks see my tabs? Amazing. Okay, I'm gonna go with, so this is my Canva account. So again, KSAC already has a lot of materials and brochures and pamphlets, but I know that our content can get really, really jargony. So specifically for this event, you don't have to do this, but it can be really helpful to maybe create something again that you know that you've put through these kind of grammar edits that make it maybe a little bit less jargony, more easy to read. I tried to, on mine, again, take out a lot of, I would usually add a lot of extra like background color, but I wanted to make it just as clear as possible and really easy to be something that, again, I could upload into Google Translate if I wanted to. Folks could take a photo of this and upload it to their own device. There's a QR code for the website. So just little things like that that obviously we don't all have all the time in the world to make things, but just keeping those in mind. So I created this and then I wanted to again just double check kind of all of my wording. So I copied and wrote out all of the words that I had on that document into Hemingway, and hopefully you can see the options it gives. So it highlighted this yellow sentence and said that it is a little bit hard to read. Now, there's only going to be so much I can do because our center name is long, so there might not be that much that I can change about this one. And then I have a red highlight, which if you look over here, says that it is very hard to read. So this is me describing that our services are available for people who live in, and then I list the 4 counties. That's something that I could probably change again because I really want to focus on like what is the information I want people to know right away. If people have the option to, again, go to my website and spend more time on their own translating, then I don't necessarily have to give them every single tiny little bit of detail right off the bat. So maybe to make this easier for folks to read right away, I say our service is available hellos in Peterborough. And sweet. Okay. And now it's eliminated that red line. So now we're considering this sentence much, much easier to read. And over here, I went from a grade 9 readability to grade 8. So again, if you keep it around there, that's a good kind of way for folks who are learning English. So then I can go from there and just say, okay, well, now I know exactly what I want to edit on here. I'll edit that statement here. So that is how you can use Hemingway. Again, there's different tools if you do decide that it's something you're going to use a lot and want to pay for it. There are options. Again, it'll check spelling and grammar and rewrite things for you. But at its base, this is really helpful just for ensuring that things that you're handing out on flyers and things are at a readability level that more folks are going to understand. So hopefully that was helpful. Hooray. Do, do, do. Amazing. People, great. Again, very, very similar setup to Google Translate. There's your most likely going to be English that I'm putting in, and then you can choose here which language you would like to translate to. So there's still quite a few. As we can see, we have Arabic there, so that's one of the, most spoken ones that we know from NCC clients, Ukrainian, but we're missing, some of those other ones. So there's no option to do Farsi or Dari here, no option for Somali. So again, with this one, if you remember, it's going to get a little bit better nuance with these languages, but it's going to not have as many options. So it's pretty simple to use. So you can type in here, hey, hi. Great. There it is. Stunning. That's how you say hi in Arabic. Obviously, that is typed out, and then you can obviously speak into here. Disclaimer. Oh, I consent. Hello. It's listening to me. All right, you get it. Oh, stunning. Right. So that is something, again, you can have the website open or you can have the app on your phone. It's probably easier on your phone. Just I don't know, I type way faster like this, and it's really easy to just like click the microphone and do that. Um, so yeah, 33 languages, so still a good amount. And then again, you can do files. So if it is something where you have a brochure or something that you want to translate ahead of time to have, you can, it has to be in a PDF or a Word document. And you only get a certain number with the free account. I think you can do like 3 per month or something like that. So if you have stuff that's a Word document or a PDF or a PowerPoint, you can put it through here. Um, Google Translate, a nice little classic. Again, very, very similar setup. I do have the Google Translate app on my phone. It is very user-friendly and easy to use. So same things. Here I am. Fine. But as you can see, there's a lot more options for languages. So again, Google Translate, maybe not going to get as much of the nuance or grammar with these. It's, but you've got a lot more, which is helpful because again, it's got all of the languages that we know were the top 4 spoken, but also if you remember from that survey, there was like almost 100 different languages from just folks that had answered that. So this is gonna give you many more options. This you can upload documents. It just says documents, so probably the same ones, PDF, Word document, PowerPoint. And again, this one you can also do images. So if you have, brochure file saved as images on your computer, you can put them here and then they will translate for you. It's great. You can also do websites. Sweet. Alrighty. Hopefully that was semi-helpful and not too speedy. I have to work on talking slower because that is how I naturally talk, but yeah, amazing. So I guess that's kind of the bulk of what we had, but wanted to open up the floor and see if anybody had any questions that they wanted to run by us about the event or translation things or
Hi there, I do. I'm so sorry. I don't see where I can like raise my hand, so I'm just maybe jumping out of turn here a little bit. So I have 3 questions. The first one is a little bit more generic. So do you have a sense on how many people will be attending?
I mean, we had like 150 come last year, and it was, we got a lot of feedback that folks enjoyed it and wanted to have it as an annual thing. So I would estimate probably that would be close to 150.
Perfect, thank you. And then the next question I have, do we have a sense in terms of whether people have OHIP coverage or if they have interim federal health coverage or if they don't have either or whatever the case may be?
Bisham, you might be able to answer that better. I think it's
Yeah.
going to be a mixture.
Yeah, so I would agree. It'll be there will be some that will have OHIP, and there will also be a few that will not. So it will be hard to say beforehand because it's open to anyone. But I would prepare for there to be folks that do and folks that don't as well.
Perfect. And then my last one, it is a very specific question. So, because I work in cancer screening and prevention, one of our cancer screening topics is cervical cancer screening, which I know is a very, like the term cervix doesn't have, it's not able to be translated. So, we do have mannequins or models, and I didn't know if that would be culturally insensitive to bring out or if that would be okay to help describe what happens during cervical screening. I just don't want to push my boundaries a little bit.
I would say that I think you're fine to still bring them. It's an
Okay,
important part of health and women's health. So I would encourage you to bring them still.
perfect.
Yeah, great
Thank you.
question, Caitlin. Thank you so much for asking that. And yeah, bring it.
Mhm.
Perfect. Thank you.
Model. Yeah,
Thanks,
no, that's
Caitlin.
great. And that's also maybe something too to keep in mind is like knowing which services at your place, like, is like, do you need referrals? Do you need OHIP? Like those sorts of things, because those are probably going to be commonly asked questions, because it's going to be different for everybody. So if you, again, either on your things, if you have it written on there, or if you just are able to make sure that everybody who's going to be at your booth knows those things. Because yeah, it'll be common questions about, do I need a family doctor? Do I need a referral? Do I need OHIP coverage? That sort of thing. Other burning questions? There are no dumb questions.
Hi, Jocelyn. It's Becky here. Hi, folks. I'm sorry I'm jumping on late. I'm so grateful that you recorded this meeting. I will review the beginning. Um, so I'm just thinking about in our business case, we do have program development that will happen centering around harm reduction. And I'm wondering if it would be at all of interest to offer naloxone training at your Newcomer Health Fair. Yes or no. You can pass if you don't think that it would be a good match.
I think it would be great. However, we've already filled the schedule for the day, so it'll be a bit difficult now to fit something in. So I would say, like, certainly you can bring that material and share that information with folks, and then we can find alternative times where we can facilitate a training on Blockzone, and we have done that in the past with people as well. So I would say that maybe for this event, because the schedule is built already, we can prioritize an alternative time to do this.
Thank you.
Any other questions?
This is Crystal again from Canadian Council of the Blind. I do have a question. We will be bringing in guide dogs, and I know a lot of newcomers to Canada are terrified of dogs, but that is our point. We want to make them feel more comfortable with the guide dogs. And so I don't know if that's going to create a problem or not.
I would say that you're right. A lot of newcomers are afraid of guide dogs, but a lot of the times it's mainly around educating them about the purposes of the guide dogs and why they're there. And so I think it's really great that you're bringing them along, and we can ensure that where we place you is a space where there's a little bit of open space that the guide dogs can be, and they're not going to be cramped as well.
Thank you.
Anything else? Okay. We will send out the recording and the slides today or tomorrow morning. So you'll be able to replay it. And if you have any questions, please do feel free to reach out to myself, Allison, Jocelyn, or Marisa at NCC. And we'll be happy to answer that as well. And again, thank you all so much for being willing to present our clients on third, and look forward to engaging with all of you then.
Yeah,
Thank
thank
you.
you all. We're really excited.
Thank you, everyone.